Hello and welcome back to the American Academy of Research and Academics podcast, your comprehensive guide to research excellence. I'm your host, William, and today we're expanding our research horizons beyond large data sets to explore other vital methodologies, observational studies, specifically case series and cohort studies. For international medical graduates, understanding and engaging in these types of research can significantly diversify and strengthen your residency application, showcasing different analytical skills. Let's explore these powerful avenues of inquiry. What are observational studies and why do they matter? So, what exactly are observational studies? Unlike randomized controlled trials, these studies observe and analyze existing data without intervention. Case series describe characteristics of a group of patients with a particular disease or exposure, often highlighting unusual presentations or outcomes. Cohort studies follow a group of individuals over time, a cohort, to see how certain exposures or characteristics relate to health outcomes. These methodologies are invaluable because they reflect real-world clinical practice and can identify associations that might not be visible in highly controlled settings. They are crucial for generating hypotheses, understanding rare diseases, or tracking long-term outcomes in diverse patient populations. While perhaps not always having the scale of national databases, they offer depth and clinical relevance, capturing nuances often missed by aggregated data. How observational research boosts your residency application. In the competitive US residency match, showcasing diverse research experience is a significant asset. A well-executed observational study on your CV tells program directors several key things. You possess strong clinical observation skills and can identify important patterns in patient care. You understand epidemiological principles and how to collect and interpret real-world patient data. You're capable of contributing to medical knowledge even without access to large, complex databases or traditional lab settings. For IMGs, this type of research can be particularly accessible. You can often leverage data from your clinical rotations or collaborate with attending physicians on existing patient cohorts. It demonstrates your engagement with clinical science and your ability to translate clinical questions into research projects, overcoming geographical or institutional barriers. The long-term value. Observational studies for fellowship and beyond. Your research journey doesn't stop once you match. Observational studies continue to hold immense value for fellowship applications and academic careers. Many subspecialties rely heavily on this type of research for understanding the natural history of diseases, identifying prognostic factors and risk associations, evaluating long-term effectiveness and safety of treatments in diverse real-world settings. Early experience in observational studies equips you with skills in patient data management, clinical epidemiology, and longitudinal analysis. This means you'll be well prepared to contribute to ongoing research in your fellowship, develop new hypotheses, and even initiate your own long-term cohort projects, solidifying your profile as a well-rounded academic clinician. Becoming a sharper clinician through observational insights. Beyond academic accolades, the process of conducting observational research directly enhances your clinical acumen. When you meticulously analyze a case series of unusual presentations, You become more astute in your diagnostic approach, identifying subtle clues in complex patients. By following a patient cohort over time, you gain a deeper understanding of disease progression, treatment responses, and the factors that truly influence long-term outcomes, moving beyond textbook knowledge. You develop a critical eye for recognizing patterns and anomalies in your own patient population, making you a more thoughtful and evidence-informed practitioner. This type of research trains you to observe, document, and analyze in a way that directly translates to better patient care, enabling you to anticipate challenges and tailor interventions more effectively. Getting started. Your pathway to observational research. So, how can you, a busy medical student or IMG, get involved in observational research? Identify clinical questions. Start with interesting or perplexing cases you've encountered. Why did this patient respond differently? Or, what are the common features of this rare presentation? Seek clinical mentors. Physicians in clinical practice often have access to patient data or ongoing cohort studies. Reach out to attendings during rotations or through your networks. Organizations like the American Academy of Research and Academics can help connect you. Learn data collection and management. Observational studies often require meticulous chart review, data abstraction, and secure data management. Training in these areas, often offered by research programs, is essential. Master basic epidemiology and biostatistics. Understand concepts like confounding, bias, and appropriate statistical tests for associations. Platforms like ours offer tailored support and training. Focus on clear reporting. Whether it's a poster, a presentation, or a manuscript, clearly articulate your methods, findings, and their clinical implications. We'll guide you through the process of getting your work published or presented. You don't need a lab or complex equipment. You need curiosity, attention to detail, and good mentorship to turn clinical observations into impactful research. In conclusion, while national database research offers incredible scale, delving into observational studies like case series and cohort studies provides a unique and equally valuable pathway for IMGs to build a strong research profile for US residency and beyond. It highlights your clinical acumen, analytical thinking, and commitment to evidence-based medicine. Don't limit your research horizons. Explore all avenues. If you're ready to explore these and other research methodologies, visit aaracademics.com. Connect with us on LinkedIn or Instagram, and let's turn your clinical curiosities into impactful research contributions. Until next time, this is William, and you've been listening to the American Academy of Research and Academics podcast. Observe, analyze, impact.